Welcome to the examination room here at the Cedarview Animal Hospital in Barrhaven. Callie is having a heyday here. I think she's had about 24 of these liver treats. You're her new best friend.
I can't promise what's going to happen afterwards when you take her out for a poo.
Exactly. Allow me to introduce Dr. Nigel Gumley. He is the owner and veterinarian here at Cedarview. Thanks so much for having us today.
Oh, you're welcome. Yeah, welcome to the hospital.
Yeah, well, it's a gorgeous facility. How much space have you got here?
About 2,500 square feet. We could use a bit more space, but it's working for us.
Well, I can imagine with all of the different pieces of technology that you've got here, not only are you fairly advanced, but I could see you needing a bit more space to operate it all in.
Yeah. Well, the dogs need the space.
Especially ones these size.
Exactly.
Okay, so what exactly are we about to do with Callie here?
Well, we're going to do an examination for Callie for mobility. We're going to see if she has any issues with her legs and joints.
She's hunting for more treats.
Yeah, exactly. We're trying to keep her fairly relaxed because I'm going to go through and I'm going to do a physical exam on her spine and on her legs and her muscles. And I'm probably going to find some ouchy bits if she has them. So because of that, I don't want her getting nervous and scared and wanting to run out the door. So I'm going to ask you to help me. We're going to just give her some little treats as we go. I'm also going to use them to try and test her flexibility. So we'll see how she turns around, how her neck is in the spine.
Okay. And this is the examination that you would typically do for dogs that may have had some past injuries, or to basically just assess whether or not they might need your sports therapy portion of the clinic, right?
That's right. So we do a lot of rehabilitation here. Physiotherapy in human terms, we call it rehabilitation for animals.
Okay.
So yeah, we see a lot of dogs for orthopedic problems. They may be post-surgical, they may have had a fracture repair or a ligament repair. They may have injured themselves in sports, as you said. They may have some neurological issues, and a lot of older dogs too, and some cats too. So yeah, we do. That's our specialty in this practice.
Okay. Well, hopefully you haven't got any problems, Callie. Okay. So what's the first thing that we should do?
Okay. So we're going to just test her flexibility. I'm going to just look at her spine here, and one of the best ways to do this is just using our treats. We're going to just see if she wants to come around, and she should normally be able to touch her shoulder on each side, and that tells me that she's quite comfortable. If I try and do this manually, just pushing her head around, and there is something sore there, I'm going to be cranking that. She's not going to be too happy with me. I'm going to let her tell me if it hurts. So that's a good way to do it. And I'm going to give those over to you.
Okay, nice and slobbery.
Yeah, there we go. Okay. So what I'm going to do now is I'm going to just walk down her spine, and we're going to have her feel, there we go.
You're so great with the animals.
Yeah, I'm getting drool all over me in the process. And we're just having a feel there. We're tapping each of the vertebrae. I'm just feeling if she's got any tension on them. Sometimes we'll get down in here if they've got some lower neck pain. They'll give me a little ouch there, and you'll see them tighten up or spasm a little bit. But she's quite comfortable, and I could assess that also with her mobility. I'm now going to just move, and we're going to get you to stand up. So if you want to come around here, Sarah, there we go, sweetie. That's it, and you can just continue to give her little treats every now and again.
And what are you doing now?
So now we're going down her thoracic spine, the spine over the chest. We're just pushing on the tops of the vertebrae. So this is like us, our spine going down our back. I'm just palpating them. Again, if she's got any tension in here, if there's any sore bits, I'm going to get her spasming a little bit. She may look at me telling me that it hurts, or she may just drop down. She's really comfortable. So this is good. And then what I'm going to do, once I've done this, is we're going to work on her legs.
Okay, so far so good then, right?
Everything's fantastic.
Okay, so we'll go through the rest of the legs, and then if you were to find something, the next step would be what?
Well, once I find something, my technician is making notes as I go, so I'm just kind of calling out things. And once she's got a list of all of the problems, she's going to take that list and she's going to develop a therapy plan.
Okay.
So, and what we do for therapy depends on what I find.
Okay, so a little bit later in the show we are going to put Callie through the therapy plan, and from what I've heard it's going to be pretty interesting. I think I'll be involved too, right?
It's a lot of fun, and yeah, you'll be very much involved.
Okay, stick around. That's all coming up a little bit later from Cedarview Animal Hospital in Barrhaven.